we're going to move on to our next talk, which is going to be kind of Black in Anatomy, starting hard conversations on systemic racism in anatomical sciences. And this is presented by Melissa Carroll, who is an associate professor at the George Washington University School of Medicine. Melissa is a member of the of the American Association for Anatomy and the Human Anatomy and Physiology Society and the American Association of Clinical Anatomists. And she's one of the founders of the Black in Anatomy group, a grassroots organisation aimed to promote, amplify and celebrate Black contributions to the anatomical sciences. We're delighted to have you with us today, Melissa, and over to you.
Thank you so much for the introduction. Greetings and salutations to everybody that's across the globe. I know that it's different time zones, so I appreciate your time here. As was said, my name is Melissa Carroll, and I just would like to also thank the organizers of this program for the invitation to speak today at the symposium. I was asked to provide a talk on the origin of Black in Anatomy, so that's where we'll start. But I also want to take this opportunity to discuss equity in the framework of racial and population diversity, which in my opinion includes having some tough conversations about systemic racism. So I do want to just bring everybody's attention to the stock photo that I intentionally chose for my title slide, primarily because of the individual that you can see in the middle, who looks very much similar to how I would wear my hair. And in an opportunity, it's representing having a seat at the academic table. So I would like to start this talk also just discussing the origin of Black in Anatomy. So in the wake of a very disastrous year that will hopefully never be repeated in our lifetime, 2020 was really difficult, and I found myself personally and professionally and emotionally exhausted. I was very tired in addition to all of the atrocities that were happening in North America. I was very tired of seeing my professional identity as an anatomist in contrast or clashing with my personal identity as a Black woman. I was very tired of what I perceived to be a significant ignorance to the contributions of underrepresented minority groups within the anatomical sciences. And so it gives me great pleasure to hear the presenters that came before me to see how much work has been done to improve the inclusion and the representation in visualization and in images. And I 100% agree with Gabrielle and Claire in respect to the fact that it is really circulating around kindness. So it was really interesting also where you see some of the push to get rid of eponyms from anatomical terminology, because it further highlighted the white male domination within our field. And I just kept thinking to myself, of course, after being exhausted of all of the things that were happening with the civil unrest, isn't there any data to support that there are anatomical concepts or anything that was done outside of just the white male dominated field? And where were the people that looked like me in anatomy? And especially when we consider that bodies like mine were unceremoniously brutalized over years, decades, and centuries for anatomical investigation, I knew that my curiosity had to be shared amongst other individuals across the world. So in October last year, I created the Black in Anatomy Twitter account, and I put out pleas for people to join me. At the time, there was a big wave on social media for the Black in X groups, and I looked for a Black in Anatomy group to start my own networking, and there was none, so I created it. In October of 2020, I put out the request, and I was so pleased that we had a couple of colleagues that came and responded, and have been working tirelessly with me over the past year. These colleagues have been amazing in the fact of They're being founding members of our organization and working to address some of the questions that I brought to the table, and also allowing us to have a safe space to vent any feelings of being tokens in opportunities for diversity, any type of frustration with what we call the minority tax, and also that shared responsibility that we felt to educate masses about differences that really are only prominent because we choose to focus on them. Social media gave us a great opportunity as a core group of colleagues to now see that our small grassroots organization has filed our articles of incorporation to become a nonprofit in the United States. So we're very proud about that. We also put out a question just to see where people might have been interested in focusing their attention, and it turned out that Black anatomical history really was an opportunity for us to focus in. And our team would not be complete. I really have to honor and thank Naomi, who has been our medical visualization specialist, who's created our logos, everything that you see on social media. She created our website. That visibility and that social media presence really would not be possible without her. And so she has been an invaluable member, an invaluable ally to us, and full support, even teaching me how to use hashtags appropriately. So I really appreciate her. But in transitioning, we really have to get into that hard portion of what is the definition of systemic or institutional racism. So originally, structural racism was a sociologic term. It was used to address those things that were embedded in cultural practice, any racial biases that were so ingrained into society due to any assumptions or policies that disenfranchised Black, Indigenous, and all people of color for years and decades and centuries. Structural racism and the power imbalance is really is what we blame for me being harassed by the local police when I was a grad student, leaving the anatomical lab in scrubs and my hair rode in braids, driving home and being pulled over just because I was Black. In that same week, I was pulled over, or should I say in that month, I was pulled over 3 times by the police. And as a Black graduate student, having to have that pressure and then still come to school to perform, it's a difficult place that you have to recognize what your students might be going through that they can't share. They don't have a safe space to share it. They don't have a place to network, and they don't see people that look like them. And so in recognizing after time and time again, asking why was I being pulled over, being a stone's throw away from my apartment, and having the police flashing lights asking me what I was doing in the neighborhood, it really beats you down as an individual, as a professional, and in trying to maintain the high standards that as a Black individual in North America, you're always told you have to work twice as hard to get the same opportunity. So it was an interesting opportunity for us now to start realizing that I don't want to use the term that there was racism, but I will use the term that there was racialized influences that I was exposed to. Things that, as growing up in the Bahamas, where everybody did somewhat generally resemble me, and coming over to the United States, it was quite a different experience. So in looking further into systemic racism and recognizing that when you see the best practices of trying to figure out any type of systematic inequity is really to identify questions that can be data-driven, their answers can be found. You have to recognize what we are exposed to within the anatomical fields. Traditionally, the knowledge and acceptance of current inequities really create for us a power to initiate any change that we would like to see moving forward from this day. And therefore, it's critical, especially as anatomy educators, that we hold ourselves accountable to understand the history of our individual organizations that include the IFAA and the potential for any population bias and racialized histories that we're exposed to. In the full gamut, we have to recognize that the focus on any DEI concerns should not be viewed just as trendy, but also not just as a right now pedagogical change, but an opportunity to truly progress towards long-term change. And unfortunately, whenever we push against change, we run into opportunities of opposition. So giving examples again from North America, and I'm sure we can pull out examples globally that we see certain things. Fortunately, some political leaders can use their power to erase from history even lessons that we're getting about, for example, the critical race theory. And in regards to the critical race theory, it's an opportunity for us to see how race and politics and even law have been influenced over the decades of use. And so when we look at these examples and the suggestions for removal, we can actually see that lawmakers in Texas are suggesting that we remove any history about Native Americans, Cesar Chavez, Martin Luther King Jr., and also, of course, the history of white supremacy and eugenics. So we, not recognizing that our students might be coming into our classrooms not being educated at all with this history, the challenge is truly up to us. So what I would suggest for all of us within the academy and also producing anatomical research is that we recognize, yes, we've come from a Eurocentric, white male-dominated field, which could be potentially jarring and offensive, but we have the opportunity to change that. From a historical perspective, anatomical research did focus on racial differences that could have been viewed differently from the sexism or homophobic studies that have also been out there and other inequities that we see. So it's our job to really dismantle the misconceptions about race and have an opportunity to focus in on adjusting those deep-rooted systemic racism or racialized theories that are out there. The goal of Black in Anatomy is not to solve this problem. The goal really was to invite colleagues that not only look like me, but need a safe space to network, an opportunity to see our predecessors that contributed significantly to the field to be amplified and highlighted as well. And that was our goal primarily this week. And thank you to everybody that participated in Black in Anatomy this week. As allies and contributors, it's our responsibility to change the current problems that we're seeing in our academic classrooms. It really falls on us to increase the visibility of any underrepresented group that we see across the board. And through doing that, we can support and amplify colleagues from different cultural backgrounds. In our research, we really should be looking around and figuring out what are we doing to educate ourselves on the lived experience of some other culture outside of your own. Also, what are we doing to ensure that we have colleagues that are from intercultural backgrounds that are on our research teams and that we're elevating and amplifying those around us that need that little push. In that dissemination of research, we really should share the credit of ideas, promote underrepresented authors, and as you might have seen on my prior slide, we need to cite articles that have been produced by underrepresented researchers and professionals. With that being said, I just wanted to leave you all with an opportunity to self-reflect and take some time to consider these questions. And I would like to ask you, how do you keep yourself accountable to create a safe space for others that are outside of your culture and outside of your comfort zone? How can you make a personal commitment to find an intercultural collaborator if you haven't already? And that also means don't just keep asking the same person. make sure that you're diversifying your field enough that you're actually elevating more than just one person or more than just one cultural identity. How comfortable would you be in advocating for funds and resources from your seat at the academic table, making sure that you're recognizing that a lot of cultures have been disenfranchised and funding is not easily available as it might be for those of you that have already made your way to that table discussion. How also do you plan on educating yourself about the racialized history within your institution or your professional organization? And I also ask you, how can you challenge your implicit bias and create safe academic spaces for colleagues and students? And lastly, if you're involved in any of the academic decisions for promotion as well as advancement in your institution, how can you actually reward any DEI work so that it is a portion and a positive interaction on that minority taxed individual? So I want to highlight just two articles, one that came out earlier this year that I was able to have the pleasure of working with a couple of individuals from AAA, that we identified what professional associations can do and have been doing to address some of these systemic and structural racism issues, and also to highlight my colleague, Dr. Allison Nesbitt, who was also highlighted in the Wiley article inside, as well as Sean Bolton. So thank you guys very much. If you have any questions, concerns, or comments, feel free to contact.